have Dr. Sandeep Jauher, who actually is a writer for New York Times, and I really enjoyed the recent article that he wrote. Dr. Jauher, good morning. Dave Samadi here.
Yeah, good morning.
Thank you for being with us. I want to talk to you about the whole house call and whether doctors should start doing house calls or not. We know that years ago, about 30-40% of doctors were making house calls, but of course that has gone away because of efficiency and cost. But as the American population and the elderly population is growing, we're seeing 85-year-olds, 90-year-olds coming to our office with wheelchair. It's much difficult for them to come. The discharge planning from the hospitals are not so great. So should house call be back? And as we're getting older, the doctors would make house calls. What's your opinion? And I'm interested in the article that you wrote.
Well, in the article, I called for doctors to start making house calls again. And the fact is that what you just said is very true. That millions of Americans are homebound. How are they going to get to their doctor? In the article, I talk about an elderly woman who, she was 92 years old. She was getting ready to be discharged from the hospital. She had congestive heart failure. And I was explaining to her her discharge plan, and I wanted her to follow up with me in the office. And she said, "Can you come visit me at home?" And my automatic response was, "No, I can't." And the fact is that, you're right. It doesn't make economic sense to make house calls for the individual doctor, but for the whole healthcare system, I think it does make sense for doctors or their surrogates, nurse practitioners or nurses, to go into the patient's home and really understand what's going on there, because that is just key to understanding why they keep, coming back to the hospital. I've made house calls in the past. I don't make as many as I would like, but when I make a house call, I learn a lot about why patients are coming back and forth and turning the ER into a revolving door.
Well, I think a lot of times we don't give enough information. I think they're getting older, so if you look at the list of the medications that some of the elderly are on, they're coming now with bags of medications, and as dementia and Alzheimer kicks in, they are having a lot of difficulties.
Yeah, absolutely. And it's not just the number of medications, but sometimes you don't even know whether they're able to get their medications. I had a patient who kept coming to the emergency room, and finally he lived about a mile from the hospital. I wrote about this in the article. I went to go visit him at home, and it was there that I learned that his wife had stopped driving. So no matter what I ordered, he wasn't going to be able to get the medications anyway. It's those things that are just key. And, I wrote in the article that patients' homes should not be a black box.
Absolutely.
And I think too often they are.
All right, let me ask you something. In your article, which is you gave some really great statistics, 1 in 5 patients are rehospitalized, meaning that they go and within a month after their discharge, they bounce back. And the cost of this readmission is about $17 billion would be in Medicare cost. And that's a significant amount of money. Why don't the hospitals and the whole healthcare system devote a series of doctors? And because I know for you to go all the way to New Jersey to see a patient and come back, it's not going to, you're not going to make a living, and compensate you for house call doctors. I mean, that would be great for a lot of these elderly. And also you keep the patients away from the hospital and the risk of infections. You have an 85-year-old that comes to the ER and ends up going home with the E. coli. That's not going to be good for them. Yeah,
people are already doing this. I mean, house calls are, even though they're still about, probably less than 1% of all doctor-patient encounters, it's growing. And in the last 10 years, with changes in reimbursement, house calls are now being reimbursed more exorbitantly than they were in the past. So you can make more from a house call, as you should, than from just a regular office visit. But the fact is that hospitals respond to financial incentives, and there are penalties in place if hospitals exceed the average 30-day readmission rate.
That's right.
And so that's sort of prompting some hospitals to invest in house calls and other sorts of programs. But the fact remains that for most hospitals, the readmission penalties aren't enough to
To push
force
them to
them
make
to
this happen.
invest.
That's
To
right.
force them to invest, because it still makes more economic sense for most hospitals to just readmit the patient and get paid for a readmitted patient. Most hospitals want to keep their beds filled, even if it's with readmitted patients.
I have a feeling that, Sandeep, that's going to change in the future. And I know that many hospitals, such as North Shore LIJ, they have these Go Health, and I know Mount Sinai and others, they're all like opening up these urgent care small places in like shopping malls all over the country to be able to get these patients and keep them away from the emergency room and
Yeah.
can be able to take care of them. So I think like the whole landscape of medicine in the next decade is going to be completely different. Well, it's very interesting concept. I appreciate you bringing this, and I think that house call is probably on its way back. Thank you very much for being with us.